there's all things we need in ITP. There's a long list. For example, it would be great to have a diagnostic test or a range of diagnostic tests so we could confidently diagnose the disease. It would be nice if we had some biomarkers of risk, so that would guide us in treatment. Again, we don't have that really. We need, the unmet need, of course, in terms of guidelines is that because of the changes in practice, we need to update the guidelines much sooner than we did between ASH 2009 and then the recent one, and then the consensus 2010, and then to consensus 2019. We can't wait 10 years. So we're working on an update now. That's a definite unmet need. There's always an unmet need in terms of treatment, because there will always be people who fail most of our approved therapies, and we will always be looking for new types of treatment for those patients so they don't suffer, they don't bleed, they're not, because they're at risk of serious bleeding events, and sadly in some cases they die. So we're always looking for new therapies for this disease. So those are the main things that I can think of: being able to diagnose, being able to predict who needs treatment. Having a nice algorithm would also be very useful, having an actual stepwise diagram that would take people through the prescribing pathway rather than the slightly confused algorithm that we have now. That's another thing that we need to work on to guide clinicians who are not experts in ITP. We find it difficult as experts, so non-experts must find it even more difficult deciding, is this the right drug? Is this the right time? What dose? How long? There are so many things that are not really fully answered. So we have a long list of things that we are working on.